Integrated Care Board. Well, as the Integrated Care Board doesn't start till the 1st of July, but we are about working together across all system partners, so health and social care, and my role is to support people and the people plan and everything health and well-being and leadership. So this week is all about people. It's all about taking the time to think about ourselves, to connect with others, and to educate ourselves on some really important topics for us as employees of the LLR health and social care system. Sessions like this are incredibly important to connect, to understand each other and to understand the different challenges we might face, whether you're a manager or you're going through this yourself. So we've got Claire Burns today for the next hour. Claire is going to run through a series of slides in a webinar type approach, but we'll keep an eye on the chat. If you want to put your hand up throughout the session, if you've got any questions or anything you want to share, we'll do our best between myself and Claire and Mariam to bring you in as appropriate. Just before I hand over to Claire, I just want to remind people about the LLR Academy website. All of the details around this week's sessions are on there. If you've not quite booked on for the full week yet, please go on there, please book on. There's a mixture of online and face-to-face sessions still available. And we've got our Family Fun Day on Saturday at the racecourse, so please bring your family, your friends to that session. And finally, we have got an activity and a photo challenge. Details are on the website. Please tweet, please stay connected with us and enjoy the next session. So Claire, over to you.
Oh, thank you so much for that, and welcome to everyone on the call, and as I say, thank you so much for that introduction, Alice. I'm really pleased to be asked to present today. I think it's an amazing thing that you're doing in terms of this week, really raising awareness of your people, your health and well-being as well, and I'm really excited to be part of that. So just in terms of who I am, you know, a little bit more detail. So my name's Claire Burns. I own a company called Workplace Wellbeing, and part of that company, a part of that branch is something which is my sort of my new baby, is called the Unspoken, which is about reproductive health. So as I have a background in well-being, I'm really passionate about all aspects of our health and well-being, and reproductive health is something which is not only something that I'm very interested in, but also something very close to my heart. So I have had my own difficulties, should I say, in terms of my reproductive health, and I've seen not only how difficult it can be to manage those within the workplace, but also outside. And so for this session today, you know, I want to talk to you about the fact that, you know, the Unspoken, how we work is that we believe that no conversation should be off limits when it comes to our reproductive health. So this applies, you know, when we're thinking about our workplace and actually how we should have the confidence and be comfortable to share any of the challenges or changes that we are experiencing, to see those supports that we can get as well. So as I say, we are on a mission then. This is what we are here to do as part of the Unspoken. We're on a mission to raise awareness of the challenges, you know, so things that will impact our proper functioning, maybe of our reproductive health systems, but also some of the changes that we experience over the course of a lifetime as well. And how we raise that awareness, you know, working with, you know, employers like yourself as well, is about talking about how we create safe spaces to allow those conversations to take place, how we encourage people to do the research and understand more about what people may be going through. Also, how we have a responsibility and how we can also promote what good looks like as well. So it shouldn't just be concentrating on when there is a disease or disorder present, but also how we can promote what that good side looks like. In addition to that, you know, some of the great things we can do is campaign, get behind the national campaigns, which all support our reproductive health, but also is engage in sessions like today's around training, where we really try and raise our awareness of the challenges and changes that people can face. So in terms of our time together, so we've just got just under an hour together now in terms of the agenda. These are the types of things that we'll be covering off. So firstly, we're going to explore a little bit more around, you know, what does the term reproductive health actually mean, and why is it important? Why is it something we should focus on? We're also going to ask ourselves, you know, is reproductive health a workplace issue? You know, why should we bring these conversations into the workplace? But also I want to highlight some of the challenges and changes that both male and females can experience with their reproductive health. And then rounding off the session, thinking about, what support can I offer myself and give to myself in order to support my reproductive health, but also what role can we play in helping others as well. So firstly, it's important that we look at, what do we actually mean by reproductive health? So if we look at the World Health Organization definition, they term reproductive health as a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. And this relates in all matters relating to our reproductive systems and both its functions and its processes as well. So when we think about health, what we've got to see it as is it's more than just the absence of disease or maybe weakness in areas. We've also got to look beyond that, because we can have reproductive health, but also reproductive well-being as well. So what are the actions we can take to take that further and look for improvements as well? But when we look at the why, so, why should we focus on our reproductive health? What are the reasons that we would want to do that? Well, firstly, it is something that we all have. So like we all have our mental health, we all have our physical health, reproductive health also falls within that as well. So it forms part of our overall health. But in addition to that, what we also need to recognise is that it is fluid and changing. So with our health, it's not guaranteed. It's something that we can improve with the right actions, but it's also something that if we don't look after ourselves or we don't validate those signs and symptoms, it can start to deteriorate as well. So with our reproductive health, like our mental health, like our general physical health, it's something that we have to invest in. It's something that we have to acknowledge, and it's something that, as I say, that we invest in order to look after ourselves and get it to that optimum stage for us as an individual. But when we look at our reproductive health as well, it's something that we can't just look at in isolation, because what we do know is there are many pillars when it comes to our health and well-being. Reproductive health can have impacts on all of those. So let's take an example. One challenge that a person may be experiencing is infertility. That infertility will have physical impacts on that individual. But what we also might see there are mental impacts as well. The journey through infertility is very difficult, it's very emotional, it's very highly driven by stress. All of these emotions start mixing in through that physical journey, and what we might start to see is strains developing on a person's mental health. In addition to that, if we look at it from a social perspective, if your infertility journey is something that you are going through, being around others who maybe aren't experiencing those similar things that you are experiencing might be very difficult. That might cause you to withdraw and isolate from others because that becomes too much of a painful experience. So again, we can see how the social side of it as someone's well-being might be impacted. And finally, through financial health. If you're on on a journey of IVF as a result of infertility, then that is going to have financial implications for a person. Again, those strains will be different for everyone, but for some we need to validate that that may be very impactful in terms of their financial health and well-being and their situation that they are currently in as well. So these are some of the reasons why, we need to validate reproductive health as an area of health that we really need to focus on, but also see it as how it links as well to the other areas of well-being. But when we talk about our reproductive health, what we need to validate is that we have a male reproductive system and also a female one, and they consist of different organs as well. So when we look at the male reproductive organs, what we can see there on the screen is a list of the different organs that will formulate that system. So we'll just give you a very high level run through as to the function of each of these. So the penis is the primary sexual organ of the male and that is used to inseminate females during conception. We've also got the testes, which is known as the male reproductive gland. So if you looked at the equivalent of that in a female system, that would be the ovaries. The main function of the testes there are to produce sperm and also testosterone as well. We've also got the scrotum, which is the thin layer of skin which actually houses the testes. In addition to that, we've got the epididymis, which is a narrow, tightly coiled tube that is attached to the testes, and it connects some of the organs together internally. In addition to that, we've got the vas deferens, which is located just below the bladder, and it is a long muscular tube that runs behind the pelvic cavity. We've also got the prostate as well, which is probably one of the more commonly known organs in terms of the male system as well. This is located just below the bladder, and the primary function is to produce the fluid that nourishes the sperm. And finally there we've got the seminal vesicles, and these are the glands that produce the fluid that will then turn into semen. So as you can see there, which is a very, very quick introduction, there are many, many organs that are going on and functions that are being performed individually by each of these different areas. So yes, we have our male reproductive system, but we also need to recognise as well that we have the female reproductive system. And again, like that, the male system, they are performing certain functions depending on which area it is. So firstly, we've got the ovaries. So the ovaries again are the female gland and play a critical role in both menstruation and conception. They produce eggs for fertilization, and they also make the hormones estrogen and progesterone. So an ovary's function as well is to release an egg at the midpoint in a cycle. The next organ that we've got there is our uterus. So this uterus is a hollow organ which is located in the female pelvis. The main function of the uterus is to nourish the developing fetus prior to birth. In addition to that, we've also got fallopian tubes in terms of the female reproductive system, and these can be found between our ovaries and our uterus. And the main function of these is actually for egg transportation and also fertilization. We also as well have the vagina, which forms part of the female system, which is the elastic canal, which basically connects the uterus to the outside world. It also is a channel for menstrual bloods and plays a critical role in conception, pregnancy and childbirth as well. In addition to that, in the entrance of the vagina, we have got the vulva, which is the main aim of that is to protect those internal organs. And finally there, we've got the mammary glands and also the breasts as well. The primary function of those is to secrete milk, and these are, as I say, again, the system that makes up the female reproductive system for us. But what we need to be very aware of, so whether it's the male system or the female system, is that they are highly sensitive organs. They are also organs which we need to invest in and regularly look after. That includes good hygiene and care. But we also need to make sure that we know what's normal for us. We also need to regularly monitor those normal symptoms and signs, but also start to validate if any changes start to occur as well. Because this is when the change starts to occur, is when we need to start taking action to explore why those changes are happening. So absolutely, it's important that you have an awareness of, what makes up these systems. But when we're thinking about, the workplace, then we need to start thinking, well, yes, these are the organs, these are the systems that we have, but what are the challenges and changes that we can start to face to these? So regardless of whether you have a male system or a female system, challenges can present. And what we mean by challenges is that this is when factors start to occur which prevent or hinder the normal functioning of that organ. Changes, when we're talking about changes, this is very much about when we are seeing a change from their original function to a new change. But I'm going to introduce you now to a series of challenges and changes that we can experience with our reproductive systems. But when I start to highlight these, some you will identify these are going to affect the male system. Some you will see will impact the female system, but some will also cross over as well. But I'll start to introduce what some of these are. So firstly, what we've got there is hypergonadism. So this is something that impacts the male system, and this is where we have a loss of sperm or testosterone. This creates low levels in the body. Now, what we do know is that this actually is a challenge that someone can experience. But the crucial impacts on this is that it can impact on a person's sex drive, their muscles and bones, but also start to impact on mood as well. A change you might experience, and it's something that all females will go through, is the menopause. Now, the menopause is going to be a permanent change that people will experience in terms of their menstrual cycles. So this actually, we reach the menopause when we haven't had a period for a consistent period of 12 months. Now, during this stage, what we see is a rapid decline of estrogen. But leading up to this stage, unfortunately, we don't just get to a point where it just switches off one day. What we do see is a stage that leads up to that of called the perimenopause. The average age of the onset of this in the UK is age 45. Now, if you think of your work population and the age of the population, we need to be thinking about the amount of people where this might be starting to impact. But symptoms will present, but they will differ in terms of who the individual is. For some, they will be very problematic and can be quite long lasting. Average, what we see is the menopause symptoms are around 4 years, but in some cases it can last up to 10. But some symptoms can include the hot flashes, mood changes, irregular bleeding. These are all different types of things that people can experience. In addition to that, another challenge is that we can have cervical dysplasia. This is where what we experience is an abnormal growth of cells in and around the cervix. This doesn't mean a person has cancer, but if left untreated, it can lead to that developing. These are things that are picked up through smears, so this is why it's really important that we advocate for regular smear testing, because these are the types of occasions where that will be picked up. In addition to that, something which can impact both systems are sexually transmitted diseases. Diseases are transmitted from one person to the next, mainly caused by pathogens such as bacteria. But again, if we don't advocate for what safe practices look like, we can see the increase in these spreading and developing. But also treatment of these is very, very important, particularly in females, because what we do know is it can have an impact later down the line in terms of fertility as well. But what can impact both organs and both systems are cancers as well. So cancers can also develop. So if we're looking at some female cancers, we could be looking at ovarian, cervical, vulvar, uterine and vaginal. And in males, we can be looking at testicular and prostate cancers as well. But something that will impact both of the sexes as well can be infertility. And this is where a couple cannot get pregnant despite having unprotected sex. So causes of this in women, for example, might be endometriosis or uterine fibroids, or in men, it might be low sperm count or testosterone. But again, we need to promote what good looks like and how we can help people, because also the risk of infertility can increase with age as well. Impotence is something that can be experienced in terms of male populations, very, very common problem, impacting males between the ages of 40 and 70 more normally, but it's often linked to stress. So if we're thinking of individuals maybe highly stressed, we can start to see the impacts in terms of their reproductive health, but also the use of alcohol, but it also may have physical causes as well. In addition to that, in the female system, we can see uterine fibroids. So this is where there are non-cancerous growths that can develop during childbearing years. In addition to that, which is one very, very common gynecological disorder which can develop, is endometriosis. Now, this is a long-term condition that people will experience. It is a long-term condition where tissue similar to the womb lining will start to grow in other areas of the pelvis region. It can be incredibly painful and incredibly impactful on a person's ability to lead their normal day-to-day lives and do those day-to-day actions. Peyronie's disease is something else which can develop, which is difficulties that develop during an erection for a male. This actually, in short terms, is where there is bleeding which occurs inside the penis, which causes inflammation. In addition to that, we can have menstrual disorders, so that while there might be the absence of irregular or heavy or light menstrual cycles. And then just in terms of the final two there, we can have pregnancy loss, which certainly can impact, yes, physically maybe on the female sex, but also the impacts we can also see in terms of males as well. But this includes miscarriage, molar pregnancies, ectopics, stillbirths, neonatal loss, and termination on medical grounds as well. And the final change, just a challenge to highlight to you there, can be polycystic ovary syndrome. So this is where the female ovaries are working extra time and producing more male hormones than they should. This can produce irregular periods, facial hair, and male pattern baldness. Now, I know that is a lot to share with you there, but it's just to highlight how many things and challenges and changes that can be going on for a person. But remember, with each of these symptoms, yes, we will see physical ones, but we can't rule out the impacts on a person's mental health. Are we seeing behavioural changes in the person? Is that starting to impact their social well-being, but also the financial impacts as well? But remember, we are all individuals, so one person's menopause will not be the same as someone else's, so we must treat everyone as an individual. Go back to that starting point and making sure that we explore with people to understand how it is impacting them and how we can support them individually as well. So yes, challenges and changes, it's important, and no one's saying that anyone needs to be someone's medical practitioner in terms of the level of knowledge, but an awareness is good, because then we can, when we have awareness, we can validate for people, because we understand that it is a medical condition that people are dealing with. And for some, it may be treatment can occur and that is cured for them. For others, these are chronic long-term conditions as well that people need to deal with. But when we look at the prevalence then, so yes, we've got the challenges and changes, but let's have a look at what the prevalence is like. So firstly, each year in the UK, 21,000 women are diagnosed with a gynecological cancer, and 2,300 men are diagnosed with testicular cancer. So be thinking, you know, in terms of our workplaces, it could be impacting people in our workplaces. When we look at conceiving, what we do know is around 1 in 7 couples have difficulty conceiving. This can be a very, very traumatic and stressful journey that people go on in order to get the goal at the end of having that baby. But 1 in 10 people of women of reproductive age in the UK experience endometriosis. So remember, we were saying this is a long-term health condition that can severely impact for people their ability to carry out their normal day-to-day jobs. But when we look at, you know, financial impacts in couples who've had fertility treatment, 60% of those are heterosexual and 86% are same-sex couples have had to self-fund. What we do know about IVF is there is no guaranteed outcome, and it is very, very costly as well. So we have to think of the financial implications and the stress and worry of not necessarily having that guaranteed outcome as well. Also as well, erectile dysfunction affects half of all UK men at some stage between 40 and 70. We need to factor in, you know, when we look at our workforce, we've got an ageing population, an ageing workforce as well. These are all things that can start to have impacts. As well, when we look at, you know, pregnancy loss, what we do know is an estimated 1 in 4 pregnancies ends in miscarriage. What the sad thing is that normally is we don't open up the conversations around pregnancy till the 12-week stage, because this can often be something that's experienced in silence because we haven't even declared that we were pregnant at this stage. So of the emotions that can come alongside that can be very, very difficult. And finally, around 13 million women in the UK are either peri or postmenopausal as well. So remember, for women, this is a stage that we will all go through. Now, if I just share a little bit of personal experience, it's really important that we don't jump, especially with menopause, into that stereotype of when it happens. Because I actually went through surgical menopause at the age of 33. So this is something that we know is not an age thing. What we have to see is it's a hormone thing. So the more that we are aware, so when it happens to us, unfortunately, we don't get that notification of when that's going to happen, but it will happen at some point. So it's really important that for some, that will be a natural organic process. For others, like myself, or others that maybe go through cancer treatments, it will become a surgical one as well. So it doesn't matter about age, we just know it will happen at some point. But when we look at, you know, the challenges and changes, when we're looking at the prevalence, then the question that we might ask then, well, why is this a workplace issue? You know, why is this a conversation that we need to bring into the workplace? Well, firstly, reproductive health is something that everyone in the workplace has, okay? So it's something that can improve, but it's also something that can deteriorate, and symptoms can present alongside that. But also it's not a constant state as well. Someone may have no issues with their reproductive health for 10 years, and then all of a sudden some can develop. So we have to remember it can change over the course of time. In addition to that, I think the statistics give a small glimpse of how prevalent challenges and changes are, and how many there are of them as well. So, and what we are seeing is there's a growing trend, but also a growing awareness of people wanting to look after their reproductive health and being more aware of what the good should look like and what the deterioration starts to look like. But sadly, what we do know is that the majority of these do remain anonymous to the employer and or line managers. And this is because often we don't have that outward support in the workplace around the health and well-being around reproductive health. Now, that's not to say every organisation, but what we do need to encourage is that if people want to talk about that, then this is a safe space to do that. So it's okay. So it's not to say everyone has to share everything, but if you do and something's particularly problematic, when we look at the statistics, for example, around menopause, we see a large volume of women reaching menopausal age leaving the workplace rather than disclosing that because of fear of judgment, because maybe one person's menopause seemed to sail through that and someone else didn't. So this is where we have to create these safe spaces. Also, as well, we need to recognise the impacts. So someone might not want to come and talk to you about the physical impacts of infertility, but they might want to share the worries that they have around their financial well-being, trying to fund that IVF journey. So again, it's just recognising and opening our minds to those as well. So the more that we seek to understand, the more that then we can provide support if people request that of us, that we don't shy away from those conversations should someone want to raise that with us. But one of the things that we also need to advocate for is that, yes, it can still very much be, oh, sorry, was someone, oh no. One of the things that we need to advocate for is that how do we, break down the taboo, the stigma around it. We're starting to see a great confidence now, people talking about mental health and physical health. But what we need to think about is how do we get the same confidence or get on that same path so we feel confident talking about our reproductive health as well. So ways we can do that is by, making sure that we research, we understand as much as we can. So when someone does share something with you, we can know more about that and understand what they're going through. We can facilitate those safe spaces. So we educate where people can have the confidence to have that conversation and don't automatically shy away from it because it seems like, oh, that's not quite an issue that I feel comfortable dealing with. Also, as well, we need to normalise talking about it, but also what the good and what the, illness, so what the wellness and the illness can look like when it comes to our reproductive health. We need to have the confidence to challenge stigma. So if we hear stigmatising views about what anyone may say about someone's reproductive health, that we have the confidence to challenge those. Training is also really important because it raises awareness and it equips people with the skills to have the confidence to have the conversations. The training isn't educating people to become medical professionals in that field and to be able to diagnose and offer treatment recommendations. But the training raises awareness, it helps you to validate, it helps you to show empathy to people, and it also helps you to signpost people to those professional outlets that are there to support people with those challenges and changes. And lastly, we can get behind some amazing national campaigns. We've got Ovarian Cancer Week, we've got Men's Health Week, we've got Sexual Health Week. These are all, weeks, or World Menopause Days. These are all national campaigns that we can get behind to keep the message alive around looking after our reproductive health and watching out for those signs and symptoms that may be developing. But when we think about support, what we do need to recognise is that, yes, in some instances, people will need that professional intervention, and that's absolutely fine. That is absolutely okay. And if that is needed and the treatment is needed, we advocate that people get to that as early as possible. But also as well, we need to be thinking, what self-care activities can we do? What things can we also do for ourselves to look after our reproductive health? So some of the things, it can include making sure that we have that balanced diet, that we are eating the right foods and we're ensuring that we're having those nutrient dense diets. Hydration's important, making sure that we're drinking enough water to flush out those toxins in the body to allow optimum functioning. In addition to that, regular exercise will help all the reproductive cells function well. Also as well, maintaining those healthy weight ranges for our individual self, because by doing that, we're reducing the likelihood of stress on those reproductive systems. But in addition to that, sleep is also very powerful. You know, what we does in terms of repairing the body, but also the mind and making sure that proper functioning. But other things that we can help is, you know, avoiding the things which aren't so great in terms of our system, or drinking those within the safer recommended levels. That includes both tobacco, you know, so completely reducing that intake and stopping if possible, but alcohol staying with what the World Health Organization highlights as safer drinking levels as well. But stress is also a really big factor, because what we do know is there's more and more research to show the impacts of stress not only on our mental health, but our physical health, and likewise our reproductive health as well. So all stress isn't bad for us. We can cope with certain amounts of stress, but where stress becomes problematic is when it becomes chronic and long term. This will start to have impacts on certain areas. So again, it's advising, you know, validating when we're feeling at that level where we've reached our limits, and also be thinking about what are those stress reduction techniques that we can engage in order to manage those. And finally, our regular monitoring is essential. You know, we get invitations for breast screening, you know, yearly checkups, cervical screening, you know, prostate checks. These are all checks that we should make sure that we are regularly attending, because what we do know is that these can pick up things early and can be really, really beneficial if that we do get, if there is something that is diagnosed or develops, that we can get that early diagnosis and we can get access to that treatment as soon as possible as well. So yes, you know, in terms of helping ourselves, there's some actions that we can take, making sure that we're engaging in the treatments and the medications that are offered to us. But also we need to see, how can we help others? You know, what role can we play in helping other people around us as well? And the ways that we can do that is, firstly, is facilitating that safe space, but also that sharing of good information. So when we talk about facilitating that safe space, what we're thinking actually is, how do we build connection with people and how do we communicate effectively? Because that is the difference between someone opening up and closing down to us. So some of the key points that we need to take into consideration when connecting and communicating is actively listening. So really taking on board what someone is saying and trying to understand it from their perspective. Validation is also a big thing. So we have to remember, whilst the symptoms may not be real for you or something that you are experiencing, which is very, can be the case if it's something which is very specific to a certain sex in terms of reproductive systems, it doesn't mean that it's not real for someone else. So it's about validating that I can see that that's difficult for you and that we offer that empathy. Because empathy shows the person that we really care. We can see that that is becoming problematic or troublesome and that you need support in terms of those next steps of that recovery journey as part of the challenges or changes that you are facing. But also as well is making sure that staying out of judgment, we stay out of judgment. Because what leads people to develop certain signs and symptoms, remember, this is not a choice, it happens to people. So it's not about, well, how can this person just sail through that experience and someone else finds that really difficult? Remember, we are all individuals. How things impact us are very, very individual as well. So just validating that we have different experiences. When we start those conversations, we have the same blank slate with everyone. Not everyone's journey, even if they've been diagnosed with the same thing, will be the same experience. And finally, as well, is making sure that we maintain that confidentiality. The taboo and stigma around reproductive health is very prevalent. If someone feels that they can't trust you in terms of sharing that information, then they are not likely to share it. So what we need to do is advocate that if someone wants to share it, we're going to show them that we've built that trust, they can ensure that confidentiality, and that we are going to validate, demonstrate empathy, and actively listen as part of that conversation. So yes, building connections and communicating is very, very important, but also as well is taking it to the next level. So yes, it's great that we can have conversations, but how do we move it forward positively for a person? You know, how do we help them get on that road to recovery? And we do that by recognising we play a critical role in signposting. Because what we do know is there's a plentiful supply of organisations which, if we go back to the challenges and changes slide, which are set up to support people who are experiencing these challenges and changes. So what you can effectively do either for yourself or someone else is, once having those conversations, is explore what signposting options are available. So firstly, you might look at those internal supports. So what, you know, in terms of your organisation, do you offer that we can signpost people to? We also need to explore externally, because what we do know is the bigger a support network someone has, the more likely that recovery is to take place over a quicker period of time. This might be exploring, you know, what family support do people have? What friends support? You know, can they share this with their friends? What other outlets do they have? We've also got amazing charities. So if you look in the four corners of the slides, this is just some examples of charities that are set up. So we've got the Miscarriage Association, we've got Cancer Research, we've got the Menopause Charity, and we've got the Blue Ribbon Foundation. And the Blue Ribbon Foundation, for those that don't know, is a charity all aimed at empowering men and men's mental health as well. So again, all of these charities bring together excellent toolkits, information, not only for the person themselves that might be experiencing it, but those around them as well, because they, you know, if they can give hints and tips to families, to friends on how they might support an individual, this is going to help that person in terms of that recovery journey. And finally, as well, is also exploring support groups. So for some, it can be really, really beneficial to explore with people, you know, who are going through similar experiences. What we do know is that can be very powerful, because that allows an outlet to talk about the emotions. Someone may have gone through a journey and be at the end of it, and that can be really, really helpful to people, not only validating what they're going through, but also feeling listened to and understood as well about the experiences that they may be having. So as I say, you know, it's really, really important. I want to be a constant advocate for, you know, as part of the unspoken, that, you know, our reproductive health is really, really important. It's part of our overall health. So when we focus on our mental, the physical, we also need to factor in that reproductive health as well. Because remember, there's many challenges and changes present. You might not be experiencing something now, but that isn't guaranteed. And what we do know, as we say, it is fluid and it is changing. So wherever possible, we should promote the health and what that looks like, and keep maintaining those actions to keep that moving forward positively. But if that illness or unwellness starts to develop, that we quickly validate those symptoms and we get on that road to recovery as soon as possible. Okay. So I just want to say thank you so much to everyone for listening. We are at the stage now where I would like to open up, and if there are any questions or comments that anyone would have about any of the information, please feel free to ask away.
Thanks so much. We haven't got any questions in the chat, but has anybody got any questions? Oh, straight away, Emily.
Hi Claire, that was really informative, thank you so much, and really great that someone is flying the flag for reproductive health. I just wanted to just remind people that those that are going through things like gender reassignment or something, that there could be people within the organisation who identify as a different gender to what they were born with, but may still have the reproductive organs, and those reproductive organs may still be working. So it's really important that we're aware of that as well. But really excellent. Thank you so much.
No, excellent, Emily, and I think that's a really great point, and that's why I think, you know, we just, as you say, we need to validate that it's a system, you know, so regardless of who that system is with, we need to validate that that's still there and not make the assumptions, as I say, as to, you know, what systems and the challenges and changes that people may be facing. But thank you, Emily, that was a really great point.
And we have got tomorrow a session on trans health, at the shed. So if anyone wants to get involved in that, booking details are online. Susan.
Oh, hi. Thank you, Claire. I would like to echo Emily's comments, how great it was, and also about the people perhaps who don't identify with the sex that they were born with. And I know certainly I've heard of experiences in workplaces where, you know, just the simple things like, you know, which toilet do people use, you know, and it's really hard, isn't it? You know, if you're, you know, maybe born as a woman and functioning as a woman, but you identify as a man, there's no like bins for your sanitary ware in men's toilets. And, you know, I've heard people say, well, they could use the disabled toilet, but they don't identify as being disabled. So, you know, I think that it's a real, you know, potentially a real huge issue.
Yeah.
I've got another couple of things about maybe we need to promote. So when you talked about sort of going for your screening, your cervical screening, breast screening, etc., is the measles, mumps and rubella vaccine, which is offered to 1-year-olds and 3-year-old preschool boosters. I don't know whether people are aware, but mumps, if you contract mumps as an adult, you can develop a condition called orchiditis, which can render you infertile as a boy, as a man. So maybe that's a sort of, you could use it to push people, particularly as the uptake of MMR is actually decreasing. And I'm still sticking, I mean, I actually do a lot of women's health, but I'm talking about men today, so it's a bit different. Is that erectile dysfunction issues, you know, you mentioned they commonly start at about 40, but they could be signs of, or certainly an early sign of things like heart disease, diabetes. So it's, you know, it's not just, you know, you can't have sex. It could actually indicate a much, you know, more, you know, underlying condition that could actually really affect your health. You know, and there's some research to say that something like about 52% of men that start to have an erectile dysfunction issue will go on to develop and have a heart attack within 2 or 3 years. So, you know, I think for the men on the call, it's something that you really need to promote. Yeah. And sorry, I'm going on a bit here, aren't I?
No, it's great.
The last thing I'd like to ask, and you might not be able to answer this question, is women's health hubs. Where's Leicestershire, Leicester and Rutland going with their women's health hubs? Does anybody have any idea?
Oh, I'm sorry, I'm not sure about the women's health hubs in Leicester.
Right.
Yeah.
I don't know either, Susan, at the top of my head, but I can certainly find out and some information.
Yeah, they are certainly being developed in other parts of the country. So Emily might be able to answer my question. So, thank you very much for listening. And
Thanks,
Susan. Yeah.
Emily?
Yeah, so sorry, just to pick up on the women's health hubs, it's a discussion that I am having with one of the PCNs in LLR, and I'm hoping that we might be able to trial something and see how it works. It'd be on a real low scale and looking mainly at menopause and that sort of area to start with. But it would be all of the services that the GP offers already, but to do it more in a where that GP with a special interest is available, so that women are accessing the right care at the right time. So yeah, very, very early, Sue, but I'll keep you posted.
Thanks very much.
Let's see, any other hands? No. Claire, I've got a question just on the back of something that Tilda's just put in the chat. And there absolutely needs to be a balance around men and women. And I think that what I've heard today was great in terms of recognising that. But also there's something around cultural differences as well, and individuals' ability to feel like they can speak up, or who they would go to for support. Any advice you'd have around that, whether as a manager or you've come together as a colleague who says, I'm a bit concerned, but I definitely couldn't speak to my male boss. or something else? Any advice?
Yeah, I think for me, yeah, you know, when we work with organisations, it's about having a good pool of people who have the training and the awareness, so it gives people choice. So ultimately, it's not that, oh, you're saying I've got to go to my line manager, but actually, you know, I'm female, he's male, and I don't feel comfortable having that conversation. And I think then it gives people the choice to go, you know, other alternatives as well. So I think it's just making sure you've got a really reflective sample where everyone would, you know, in terms of your demographics, where everyone would feel comfortable in terms of sharing that as well. And I think that often is the stigma, is because we, you know, some organisations will drive, well, no, it's a line manager issue, and we're not taking into account, as you say, the level of comfortability as well, in terms of who may feel comfortable talking to who or not. So I think for me, it's about upskilling everyone, so that, you know, if I am feeling male and you're male and I feel comfortable to talk to you, that you're comfortable to have the conversation with me as well. But likewise, that I've also got a choice, that if I would rather speak to someone, maybe, for example, of the same sex, you know, who I would rather have that conversation with as well. So I think it's a really fine balance, and it's recognising everyone's individual. So not one approach will work for everyone, but I think it's more, you know, making sure that everyone has the skills. So I've worked in organisations before where it's been male dominated in terms of line managers, and they'll have gone, oh, well, that's a woman's issue, I'm not dealing with that. But actually, what we do know is we're not asking you to be medical experts. It's about engaging, showing empathy and validating, saying, you know, I'm really pleased that you've shared that with me, so let's look at the signposting options again. So, you know, making sure that people have the confidence, and if someone does pluck up the courage and have the conversation, that they're not met with that wall of sort of, oh, you know, that's not for me to discuss with you.
Yeah, thank you so much. I'll certainly be taking away though that it's about communication and connecting, as you say.
Yeah.
The active listening, the validating, the empathy. You
Yeah.
can't go wrong with those skills, whatever
Yeah.
you're talking about, and recognising that it'll be individual, it will be transient because it changes. That really helpful, Claire. Thank you.
Yeah, excellent.
Any more thoughts or questions for Claire or the team? There's nothing else coming through.
Okay.
So on that basis, Claire, thank you so much for your time today. Thank you so much for sharing your knowledge and taking some of our questions. I've found it fascinating and I've learned something new, so really appreciate it. Marion will put this on the website. There is a really, really short survey, so if you can please click on the link that Mariam has just put in. I think it's 3 questions. We promise you no more than 2 minutes, and it really helps us design these future sessions for our staff. Okay, on that basis, Claire, any concluding remarks?
Just want to say thank you so much for the invitation. I've really enjoyed it. I know it's been a quick session in terms of a big thing that we can have endless discussions about. So, but I hope it's been high level enough just to sort of get the thought process going around the reproductive health as well.
Really fantastic. Thank you so much. And I shall hopefully see many of you in future sessions this week. Take care, everyone. Bye.
Thanks. Bye, everyone.
Bye. Thank you very much. Bye.
Bye.
Claire, do you want to just stay on just in case anyone kind of hangs back to ask a question?
Of course, yeah, absolutely.
I don't know whether people will. I think that went well. I think it was people are listening, aren't they, and kind of taking it all in these sorts of sessions.